câncer de pulmão é o tipo que mais mata pessoas no mundo. E apesar disso, apesar de todo mundo saber disso, é o que menos tem investimento. Investimento em pesquisa, em campanhas, em tratamento.
One of the biggest challenges we're grappling with is that the fastest rising subset of people who get diagnosed with lung cancer are people who never smoked. But the good news is that our understanding of the biology of lung cancer is rapidly evolving. And now lung cancer turns out to be about the most exciting place to be in cancer research.
We believe that with modest investment, we can pilot models, test and understand what works, and then partner with governments to scale the best and most successful programs. The Multinational Lung Cancer Control Program, or what we call the MLCCP, is our globally aligned framework. The idea is to streamline and align our approaches to health system strengthening and capacity building across our geographies.
One of the things that our project focuses on is trying to achieve high-quality implementation of lung cancer screening, regardless of the local resources.
No Brasil, a gente tem uma grande parcela da população que não sabe ler. Então, por exemplo, com a navegação de paciente, a gente garante que minimamente ela não se perca durante o tratamento dela, né?
The prevalence of lung cancer in Zambia is unreliable at the moment, simply because this is not a disease that we have really had on the radar screen. We suspect that a lot of TB treatment failure may actually be the lung cancer cases that we should be looking to. And so what we're doing currently with the funding that we are receiving from the Bristol Squibb Foundation is to implement a retrospective study and see if some of those would actually be the lung cancer cases that we should have caught.
I think last one decade, it has changed the whole perspective as a risk factor in low and middle income country, including India. And now it is said that 30 to 40% lung cancer in LMICs is related to the new component is air pollution.
I often say that our biggest goal is to create a situation where lung cancer screening is just another normal cancer screening. It just becomes a social norm that people consider doing if they're eligible, that there's no additional hurdles or barriers to it.